our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices and wish our friends at WHPC and our listening audience continued good health. Our guest today is Dr. Brian Mathie from Roholt Vision Institute. Dr. Mathie, welcome to the show. Thanks for joining us and welcome. We're looking forward to talking to you today.
Thanks, Paul. Always great to join you and Brad and be part of this program. Appreciate it.
There are Mathies in Louisville. Is that part of your family?
Yeah. Yep.
Okay.
Yeah.
Okay.
Yep.
Yeah.
Lots of them, actually.
Yeah, there is a bunch of them, isn't there?
Yeah. My dad was one of about 12 kids, and so a lot of them stayed around, and that makes for lots of Mathies.
Seems like they were in a brick masonry business or something like that over there.
Mm-hmm. Yep. There's Mathie Masons in North Canton, and I had an uncle who was also a bricklayer. Might have run into him.
Okay.
All right. June is Cataract Awareness Month. Cataract affects over 24.4 million Americans age 40 and older, or about 1 in every 6 people in this age range. By age 80, more than half of all Americans have a cataract. Cataract is slightly more common in women than men. This morning, we're going to talk with Dr. Mathie about cataract diagnosis, prevention, and treatment. We'd like to remind our listeners that our program will be available on our podcast, which can be downloaded from the App Store from your favorite smartphone. And we'll also have this live broadcast posted to our Facebook page and our YouTube page later today. So if you have any questions, you can post it up in the Facebook link that I made on our Facebook page right now, and we'll address them during our program.
So Dr. Mathie, welcome to the show. Tell us a little bit about yourself and your background.
Yeah, thanks. As we said, I'm from Louisville. Some people listening to WHPC may be familiar with the Mathie name. My mom was a longtime WHPC newscaster, and
that's right.
First
female,
right. Yeah, first female newscaster.
Jane, right?
Jane Mathie, WHPC. Yeah, that's right. Yeah, and after Louisville, I went to Ohio State, did a residency in ocular disease down there as well. And currently on the adjunct faculty at the Ohio State University College of Optometry, and have been working with Dr. Roholt since my residency. I'm currently the clinic director for Roholt Vision Institute.
Okay, so we know June is Cataract Awareness Month. Can you explain exactly what a cataract is?
Yeah, a cataract is a very common occurrence, and you have to first realize that all of us have a crystalline lens in our eye. So right behind the colored part of the eye, the iris, we have a little structure that's about the size of a small button. And this thing is only 1 centimeter by 1/2 of a centimeter in size and weighs 250 milligrams. And it is responsible for changing the focus for us. So when we look at something up close and then look at something far away, it's that lens that changes. Well, as we get older, it goes from being perfectly clear when we're born to getting yellowish and then brownish and even opaque eventually. So a cataract is, the name comes from a Latin derivative, cataracta, and cataracta means waterfall, because back in the day, they're like, hey, this is like looking through a waterfall and we don't know what to do about it. Fortunately, there's lots that we can do about this cloudiness of the lens, and that's what we'll talk about today.
So, like many other diseases, they say if you live long enough, 100% of you will develop cataracts. Why is this an inevitable condition?
It is inevitable if we live long enough, just like, say, gray hair. Some people get it at age 25, and some people don't get it until age 55, but eventually you lose some of that melanin of the hair and you get gray hair. With a cataract, you start with a nice clear lens, but eventually, due to this protein buildup and due to excess water that can get to the lens, it goes from being transparent to this cloudy structure. So nobody escapes that loss of transparency. The average age of cataract surgery is age 70 in the United States. So, some people, whenever you have an average, some people are going to be way below that and some people well above it. I think the oldest person that I can remember us doing cataract surgery on was a 95-year-old man. And so his cataracts didn't get really bad until he was 95, but he was a spry and spunky 95-year-old guy who had years to live, and this was compromising his quality of life. So he ended up having it done at a later age. But those cataracts can be accelerated by certain things too, like a lot of ultraviolet light. People who are diabetic have higher sugars and more fluid retained in the lens. Certain medications like steroids can certainly cause that, and alcoholism, trauma, being electrocuted, all these things can speed up the process of losing that clarity of the crystalline lens in the eye.
Interesting. Well, why electrocution? I mean,
Yeah, and the biophysics of it, I'm not exactly sure, but it has to do with a sudden change to the water content in the lens, and it becomes opacified, and it has a kind of a very unique pattern. So you could see this person years later and say, "Oh, I bet you got electrocuted pretty badly sometime in the past," and they'd say, "How you know?" But that's a type of these traumatic cataracts or being electrocuted. Certain things can cause that lens to lose its clarity.
But not the common shock from a 110 outlet.
Right. Nope, that won't do it.
Okay. So how do we know when the cataracts are ready to be taken care of?
Yeah, and that's always a great question. You know, we have patients come in all the time where if I had to guess their vision looking at their cataract, I might say, I bet your cataract is pretty bad and your vision is 20/50. And they're actually seeing 20/25 and they're happy as can be. So it really comes down to how well the patient functions. If they have a physical cataract that we can see on exam, and they have a lifestyle complaint, and the main complaints are difficulty driving at night. They can't see in low light situations like trying to read a menu in a restaurant, or it's interesting over the years how people's analysis has changed. Like it used to be, people would say, "Oh, I can't read the time on my VCR." And that was how they judged their cataracts. Now it's reading the guide on the TV with cable TV. But whatever it is, when they can no longer see the things that they need to see on a daily basis, that's probably when they need to have cataract surgery.
I recall before I had mine done, I thought, gee, I need new glasses, you know? And that was when I was still wearing regular glasses. And driving at night, as I was approaching the headlights were approaching me going the other way, it was kind of like a starlight around around my vision, almost like looking into a flashlight, like that. So, but here I was thinking that I needed new glasses. And, oh no, you got to fix these. So.
Yeah, Paul, that's a really good point, because that's a very common complaint, is that the headlights now that are brighter than ever are good for the driver, but bad for the driver on the other side of the road. And when that light hits a cataract, instead of going straight through to your retina, now it scatters, and it'll cause a halo or a starburst or just significant glare like you described. And that's what where the difficulty comes in with a cataract and trying to drive at night.
Well, you know, there's so many vehicles, like the big trucks that are sitting higher than you are in a car, and the lights, even though they're dim lights, still catch you straight on, as opposed to be sort of downward. So.
Yeah, you're exactly right.
So I remember Coke bottle type glasses. Okay, real thick brown balls for cataract pre-surgery. What was the deal with those? Why did they help?
Yeah, so the optical system of the eyeball needs about 60 units of focusing ability. And we get 2/3 of that from the cornea, the very front of the eye. When the light hits the cornea, we get a lot of focusing right away. And the rest of it is done by that lens, about 22 diopters. That's the unit of focusing. So when they first did cataract surgery, they just took out that cloudy lens and got rid of it. And they didn't do anything else other than make these glasses but the glasses had to be really, really strong to make up for these 20 some units of focusing ability that used to be in the eyeball. So that was for years and years and years. And then in 1949, a guy by the name of Harold Ridley in London put in the first intraocular lens. And how they came up with the intraocular lenses obviously took a lot of studies and so on, but kind of goes back to World War II and pilots getting shot in airplanes where the shattering of metal would get in their eye and they would lose the eye. And if they shattered the windshield and only a fragment of the windshield got in their eye, the eye was okay. They could take it out. And so the physicians realized that, hey, there's some materials that are inert and the eye can maintain, and maybe we could use that to refocus after cataract surgery. So that's where it started, but it took a long time, really until the 70s, until these lens implants became more common. So, Paul, you're fortunate that you had cataract surgery now and not in 1960s, because back then you would have had the Coke bottle glasses or the really thick lenses to try to make up for the fact that your lens is no longer there and able to focus light.
Oh, how interesting is that? I don't know. We take a break now, JD. Is that correct? You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Brian Mathie from Roholt Vision Institute. If you have a question, post it on our live Facebook.
Okay, besides the obvious benefit of better vision, are there other benefits for patients having cataract surgery?
Yeah, there are numerous benefits, and obviously we always think about vision and being able to see the things we want to see and communicate with the people that we love. But one of the great benefits is that it changes the anatomy of the inside of the eye a little bit. That lens, as we age, it swells. It takes in fluid. These proteins can swell. So it's a tiny structure, as I said before. So if it swells a little bit, that takes up a large percentage compared to what it used to take up. So once you take out that cataract and put in this tiny lens implant, we're now able to have more space for fluid to flow out of the front of the eye. And that's really important in a situation called glaucoma. Glaucoma is a disease where the optic nerve can be damaged and the visual pathway doesn't work properly because we have high pressure or there's a weak nerve. So if we get better outflow of fluid, that'll lower the pressure and protect the nerve more. So that's a huge benefit for anybody who may have glaucoma or is borderline glaucoma. The cataract surgery will really benefit them. There's a couple of other benefits too, including better view of the inside of the eye. So as we discussed, most cataract patients are going to be older, 60s, 70s, 80s, and those are the people who have glaucoma or diabetic retinopathy or other diseases within the eye. And if you take out that cloudiness, you can see in so much better. It's like looking in a window that's perfectly clear versus looking in a frosted window. So we can see the health of the eye and we can evaluate much better whether or not these people are having other problems besides a cataract. And thirdly, I think it's a huge benefit just for lifestyle. So there's been numerous studies and they all show that when patients have cataracts, they're more active than people who are not confident in seeing. And so they're more active, they're more healthy. And different studies have shown that people who don't have the cataract surgery are more likely to fall, break a hip, be injured. And so they're not as healthy in that regard. They're having difficulties because they're not seeing. And some of those studies even show depression or other issues related to not being confident, not being mobile, not doing the things they want. So there's a lot more than might be apparent when you talk about cataract surgery. It can really be a big change in multiple categories.
What about the risks involved with cataract surgery?
And that's a great question, because anytime you're going to have any procedure, whether it's a tattoo or a dental procedure or anything, you should always think about what's the risk and what's the reward. And you really don't want to do something that has a really high risk and a very minimal reward. Cataract surgery is a huge reward with minimal risk, and we're fortunate at Roholt Vision Institute to literally every single day have patients come back and say, "Oh my gosh, I wish I would have done this sooner. I'm so happy with the results. I had no idea colors were this bright or that lights were this bright." And it's such a gradual change over decades that they didn't know where they were, or they didn't know that that blue was a true blue. We've had people come back and say, "Oh my gosh, my wardrobe, I didn't realize that those clothes were actually that color." So, there's a lot of reward. But the risk that you're asking about is primarily infection. So infection is going to occur with an endophthalmitis, which means infection of that tissue within the eye, in 1 in 3,000 cases, if you look at national numbers. Now, we keep track, we do outcomes analysis on all of our refractive surgery and our cases. So we keep close tabs on what's going on. And a lot of it is just how clean the surgery center is and the surgical procedure. We know that surgeons who are more efficient and do it in a more timely manner are going to have less complications. But that's the biggest risk, would be some kind of infection. Now, those are treated with antibiotics, and most patients do extremely well, even if that complication occurs. The other complication could be something that would happen during the time of the surgery. For instance, if there was some kind of vascular problem, or there's a unit that is used to take out the lens. Way back in the day, they tried to take out the entire lens through a big incision, and now we can take it out in tiny little pieces. So the surgeons at Roholt Vision will use what's called phacoemulsification to chop up this lens into tiny pieces. The benefit of that is you can put a tiny instrument in to take out tiny pieces. But if that would somehow have too much power or cause a burn, those are possibilities too. But these are all extremely rare things that most people are not ever going to experience, but those are the possibilities.
So how long will a patient be kind of laid up, if you will, after cataract surgery?
Yeah, so fortunately, this is now with a very small incision, like I said. Surgeons that did this decades and decades ago might have to use a 13 millimeter, 14 millimeter incision to get that big lens out of there. Well, now they can do it in 3.5 millimeters, and that really small incision that's also angled in a way that it's self-sealing. So if you just made an incision straight down, that would probably leak afterwards. But if you make that at an angle, that'll self-seal, and the pressure in the eye will keep it shut. So that allows for this to heal very quickly. And these patients, even the next day, could go to dinner. They could get together with friends. And so they're really not laid up at all. The restrictions after cataract surgery, and Paul could attest to this, is you don't want to rub your eye. You have some eye drops to take for a short time. And we say no swimming, no hot tubs for that first month, just so that they don't get any water directly in the wound. As you know, water will find an area of weakness, and if that incision isn't completely closed, it could get in there. A fascinating part of cataract surgery now is that they don't have to use any incisions. Way back in the day, they'd put multiple incisions at this site, but now they can do surgery within the eye and not even have to put one stitch in. So we want to make sure that that area heals up properly. But no heavy lifting for the first week. But other than that, there's not much that's going to slow somebody down. We have a lot of golfers who have cataract surgery, and a lot of times they say, "Hey, I'm not going to do this surgery until, say, the fall or the winter, because then they don't want to be held up." But usually, even if you're a golfer, I tell them, keep the keep the driver in the bag. Don't smash the driver. You don't really want to exert yourself for that first week, but you can chip and putt the next day and swing a club just gently. Even with that's no problem.
Years ago, they had you stay on your back for 2 weeks.
Yeah.
For surgery. Okay,
Yeah.
Looking back at that, was that necessary?
You know, it was with that type of incision because with it being as large as it was, if those people got up, moved around, and went, say, head first leaning over to tie a shoe, they could have a major leak. So yeah, Paul, you're right. I hear those stories of they used to have sandbags in the hospital that they'd pack around their heads and require them to stay immobile after having cataract surgery. Now we're like, okay, go have surgery and then go have lunch. And, you know, it's amazing how that has changed. But yeah, they literally had sandbags in the hospital to pack your head so that you didn't move.
Okay, it's the bottom of the hour. Time for the news. Thanks for joining us on Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host,
Your mic is
Paul
open.
White.
It's Cataract Awareness Month, and Dr. Brian Mathie is sharing valuable information with us. So we've got a lot more to cover this morning, so let's get back to the show.
I believe you had a story to share with us about some restrictions.
Yeah, you know, restrictions after cataract surgery are important. That just that people are being safe. So we ask people not to lift things over 30 pounds and keep the water out of the eye and the wound, and to limit any activity where they could possibly get hit. But I had a 85-year-old gentleman who came in one time and he said, okay, well, now that I had cataract surgery, and this is during his post-op visit, he's like, can I get intimate with my wife, as he glances over at her? And I'm like, yeah, absolutely. Everything looks great. And he's like, that's great news. We haven't for 20 years. And I should have had cataract surgery a long time ago if I knew this. So she rolled her eyes. You could tell he was a jokester. But the good news is there are not many restrictions after cataract surgery.
What about, is there a guarantee that cataract surgery will improve a patient's eyesight?
Yeah, so anytime you talk about a medical procedure, guarantees are tough because there's always bodies that heal differently or things that can happen. But what you can look at is the numbers for outcomes and how safe is this procedure and what is the final vision. And when you look at this, cataract surgery is probably the safest and most effective procedure or surgery that mankind does. The surgery itself takes 15 to 20 minutes. You might be at the surgery center an hour and a half to get pre-op and then to look at post-op and make sure you're recovering well. But it's very, very safe, and there's no guarantee, but everybody comes out with better light getting into the eye. And as long as you don't have any complications, it's going to be a world of difference. So, yeah, we always say guarantees are not something that you should commit to. But if you just look at numbers and just look at it from a black and white standpoint, yes, there's going to be a significant improvement for all these patients who have cataract surgery.
We've probably covered a little bit of this, but what are the greatest cataract surgery changes in the last several decades, I guess, actually?
Yeah, so one of them is the incisions that we talked about. The fact that what used to be a very large incision and take out the whole lens at once, they discovered they can take it out in pieces, and that was much more efficient and allowed for much greater healing. And also the medications are a wonderful change. So when I first started, we would have a patient take 3 different medications, and they were on medications for an entire month. Well, now, and Phil Roholt, our medical director at Roholt Vision Institute, he was one of the first in Ohio to do injectable medications during cataract surgery. So instead of using all these drops for a month after surgery, he puts a steroid, he puts an antibiotic into the eye, which is slowly released, and keeps the eye quiet and keeps it from getting infected. He puts that in at the time of surgery rather than the patient have to take these drops. That's especially helpful for patients who may have arthritis or dementia or any difficulties in taking drops. Plus, there's the additional cost of buying 3 more bottles of medications. So that's a wonderful change that a lot of patients can experience. And one of the coolest things is just the technology that has gone into those lens implants. So those lens implants used to just be put in place, focus the light, try to get the vision as good as possible. Well, now we can do customizable lens implants based on the exact topography or contour of the cornea, how the light travels through their visual system, any distortions or aberrations that they have, including astigmatism, can be corrected with that lens implant. And now these lens implants can even give you a multifocal or bifocal type effect. So people who maybe had a pretty high prescription in more bifocals can have cataract surgery, and in many cases not need any glasses at all afterwards. The newest part is with these changing of the intraocular lenses after they're already in the eye. So these are all great advancements that have occurred since cataract surgery started.
So what options does a patient have when it comes to lens selection? Do we have an option?
Yeah. So each person who comes in for a cataract consultation, it's very important, and our surgeon will discuss that with them, that we find something that helps them in their lifestyle. So a lot of times we get some of this information from their optometrist, who that's very helpful for us to communicate with them. So let's say that you see somebody like Dr. Kale in Waynesburg, and he sends you to us. He might say this person is really good for monovision, or this person has been in multifocal contact lenses, and that they would be a good candidate for a certain type of lens. But we have multifocal lenses, as I mentioned, and those have improved in technology every year. They work just a little bit better. And then we also have these modifiable intraocular lenses that are coming out, and this is part of the new science, and one of them has already been approved. It's called a light adjusted intraocular lens, where the lens is actually put in the eye, and then the power of the eye is measured, and that lens can be made stronger or weaker to give you that 20/20 vision. Likewise, there's one that's called refractive index shaping, and that lens is also put in the eye, and then the power of the lens by refractive index, or how dense it is, can be changed. And this is done after surgery. So it's kind of like, fitting a suit and then getting it tailored afterwards so that it fits perfectly. And these are all incredible advancements in the technology of the intraocular lens, and these can all be discussed with the patient when they come in for a consultation.
That's pretty amazing. What will cataract surgery look like in the future?
Yeah, I think that it'll be similar to today, but I wouldn't be surprised if it wasn't robotic assisted. These robots in surgery, they basically allow you to get in a very small space, and it's very stable. So perhaps that'll be part of it. Also, using lasers in cataract surgery, they just make very precise incisions. That's something that we could afford to do for patients. Right now, it's an added expense. So again, risk versus reward, there's an additional cost. And the results are very similar to what we get even without a laser. But it's like anything else, as that becomes more affordable and becomes more commonly used, I think that a laser someday will just be everyday use for cataract surgery. And then the very individualized intraocular lenses for each patient, that'll also be very commonplace, whether it's multifocal or correcting astigmatism. So it's kind of exciting to be in an industry where we see refractive surgery and we see cataract surgery advancements that can really help the patients, and we utilize that so that they can have the best outcome at the end.
Next question should be about laser surgery, but we pretty well covered that, haven't we?
Yeah, and the question is how are lasers used maybe, and they make the incision on the side. As I talked about, it's a small incision, but when the laser makes it, as opposed to say a diamond tipped scalpel or instrument for surgery, it's just very, very precise. And then also it can be used to make the opening in the outer part of the lens, which is called the capsule. And then that laser can also be used to break up the lens, soften it, and make it very easy to be removed. So these are all very, very exact, precise applications of a laser. And that's the benefit of it, is you can measure exactly what's going to happen. We talked about with the LASIK that each pulse of the laser is 1/25 millionths of an inch of tissue that's removed. So that's the kind of precision that we're talking about with lasers, whether you're using them in cataract surgery or refractive surgery.
Now, in the LASIK surgery, the laser as well as the scalpel does that or not? Can you do it with a scalpel?
Yeah. So the scalpel and the laser can do similar things. In the hands of experienced, outstanding surgeons, there's not much difference right now. But as those lasers become more prevalent, then I think you'll just see them more and more, and the price will go down too.
I see. Why is the cost of the laser surgery more because of the cost of the equipment?
Yeah. Yep, it's the equipment, and a lot of these lasers, I don't know if you're aware of this, but like some of these original patents for refractive surgery and so on, you have to pay to use that laser.
Oh, like a license.
Patent. Mm-hmm. Yep.
Okay.
So each time you use it, there's an additional cost with that, and of course that's passed on to the consumer or to the patient.
Sure. Okay.
Well, as a pharmacist, we're always interested in learning about the medication that you might use in various surgeries. What are some of the post-operative aspects of cataract surgery, and what advancements have been made in medications that patients use?
Yeah, so like many industries, we've seen advancements in the pharmaceuticals that we use. So we used to have antibiotics that would kill some of the bugs and be protective, but they might be only gram positive or gram negative, and you'd have to use multiple antibiotics. Well, now the antibiotics are extremely, extremely effective. So these many times can be used less frequently, and they're more potent. So that's a big win. And as I said, they've also developed medications that can be injected into the eye, so they don't necessarily have to have the eye drops. So, there are some of these prescriptions that they can get at facilities like yours, and then some of them that can just be put in at the surgery center so that they don't have to worry about taking them afterwards.
So what about reasons where a patient cannot have surgery, cataract surgery?
Yeah, really the only reason that they wouldn't have cataract surgery would be if they had pre-existing eye disease, like a retina that is not capable of withstanding the surgery, or if they have a bad heart or very bad lungs. People are not put under, so you are not in general anesthesia. So most people could tolerate this, but there are some that are just so frail that they do get clearance before cataract surgery. They'll always get checked by their general practitioner and be cleared for surgery. And if they say, nope, this person's so frail, that would be about the only chance where somebody wouldn't go forward with cataract surgery.
Okay, I think our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
At a multiple pill bottle. You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now here's your host, Paul White.
Welcome back to the Medicine Center Pharmacy's radio program, Health Matters. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show coming up.
So who are the happiest cataract patients you see?
Yeah, so the happiest patients are probably those people who are farsighted to start with, and those are the people who can't see with their glasses off, either in the distance or up close. If you're nearsighted, you take your glasses off and you can read, okay, you just can't see far away. But patients who are farsighted, they can't see far or near. And with cataract surgery, as I mentioned many times, we can create it so they don't need glasses at all, or at least not need them for the distance. The other people who really love it are those active people who are playing tennis, they're playing golf, they're riding bikes, and now they don't have to wear the glasses for those activities. So they don't have to worry about it while they're swimming or sweating or whatever the case may be. And really, you know, those are maybe the happiest, but in general, they're all happy. They just can't wait to have the other eye done, or they're just so thankful to be able to take advantage of better sight.
What should a patient look for when deciding where to have their cataract surgery performed?
So I think they really want to look for a place that has a good reputation, obviously good reviews, and a staff and a group of doctors who are dedicated to that patient's best outcomes. And that usually involves using the best technology and listening to the patient and finding out what they need. So if they have those kind of credentials, that's a good place to go. And certainly Roholt Vision Institute, we try to take all of those things into consideration. And Dr. Roholt is pushing each and every day as the medical director to stay up on technology and to try to bring that to the patients of Stark County on a first time basis as soon as possible, so that they have those options to have the best technology, which usually results in the best outcomes.
You know, I think one of the neatest things about that surgery is when I walked out of the office right after surgery, I had instant gratification with that eye.
Yeah.
It was amazing. Wow.
Yeah.
You go in and you can't see, or you can see, but you can't see well, and you come out, oh my gosh, this is unbelievable. So unlike any other surgery, okay?
Yeah.
You know, you don't go out of there with a cast on your arm or, you know, whatever. So.
Right. Yeah. And not everybody has results as quick as Paul's, but most people will, that they see better right away. But sometimes there's a little swelling or a little discomfort. But in most cases, yeah, you see that improvement right away.
So explain to us how the cataract process at Roholt Vision is different from other clinics.
Yeah, so I think the use of technology, as I said, where we're really mapping out the cornea, the optical system, and determining exactly what the best intraocular lens would be. So that's important. But we kind of take an engineer's mentality to looking at these numbers and being very, very precise, and at the same time have a nurse's demeanor in being supportive, helpful, and that bedside manner of finding out, okay, what's this patient need? What's going to make them happy? What are their activities? And how's this going to work best for them? So combining all that technology, but also a place where people are happy to come in and feel like they get listened to and get the results that they want. I think all of that combined gives us the outcomes that we've been able to enjoy and patients have been able to enjoy.
What is meant by a secondary cataract?
Yeah, that's a great question. We get a lot. You know, can you get a cataract again, or can you get a secondary cataract, or what's a posterior capsule opacity? And that's when the outer surface of the lens, which is left on the back of the lens, it's left there to hold it in place and keep the eye stable. That can get opacified. And we call that a secondary cataract or a capsular haze. And it happens in about 15 to 20% of all cataracts. Now, the younger you are, the more likely you are to have that happen. And so somebody who has cataract surgery at age 40, it might be more like 40% or 50% risk that that'll happen. But it's very, very easily fixed. A laser is applied, it takes a minute or two to actually laser a hole through that opacification, and then you're right back to that clear optical system where they can see through and not have any restrictions.
Does cataract surgery need to be repeated after so many years?
Nope. And that's another question we get a lot, that do I need to have this done? And as Paul was talking about earlier, these lens implants are good for probably 100 years. So they're even putting these in children now. And so they're going to be good for the rest of the life. The eye, it's interesting, when you're born, your eye is a disproportionate size compared to the rest of your body. It doesn't grow much during your lifetime. And that's why little kids look like they have big eyes. Well, they do compared to the rest of their body. But the eye doesn't grow a whole lot. So you can put that lens implant in, even in kids or teenagers, and it'll probably be a good lens implant for the rest of their life. And certainly a 60, 70-year-old will never have to have that cataract surgery repeated.
Gosh.
Who is not a good candidate for cataract surgery?
Yeah, the only people who wouldn't be a good candidate would be people who had other health disease, or eye disease. Like if they had amblyopia or a lazy eye, that it's not going to help them even if they have cataract surgery, or if their optic nerve or retina has been damaged, then they probably wouldn't be a good candidate, because even with cataract surgery, they wouldn't see better. But fortunately, that's a real small percentage of the population.
Shifting gears a little bit, I know you're on the board of Cross-Eyed Missions. Dr. Cale's been on our show before, and he has some very interesting stories. Tell us what the organization does.
Yeah, so Cross-Eyed Missions was started by Dr. Brady Cale of Waynesburg in the year 2000, and the entire goal is to help people around the world to see better. So we collect glasses and we bring medications, and we'll take a team to different parts of the world. He's been to multiple continents and done work in the United States as well. But these are people who can't afford eye exams and certainly can't afford glasses. We will see people who have never had an eye exam. They're maybe 50 years old, and their prescription might be a -6. So translating in division, that might be 22,000. And these people are functioning that way just because there's absolutely no access to glasses for them. So we'll have an inventory of 4,000 glasses, and we will do our best to match up a pair of glasses that have been donated by somebody in Stark County, one of our patients, or somebody maybe who had cataract surgery, doesn't need them now, or had LASIK, and then we can get them to these people.
We're getting a little tight on time here, Doctor. Anything you want to jump to so we don't miss it?
Just finishing up with the Cross-Eyed Missions, we sure appreciate that support. It's a great organization, and instead of holding on to those glasses that are 10 years old, donate them, we'll clean them up, and we'll get them to people who can help. We also appreciate any financial contributions if people want to do that. And we have a golf outing every September that raises money, and that's how we pay, at least in part, for these trips around the world.
We should probably put a shout out here, because a long time ago we did, and we can take those glasses at the stores and
oh my gosh,
I have a bunch of them of my own. Pretty
yeah, that'd be great. And
bifocals and stuff like that need to get to him. So
yep, and we'd be happy to come by and get those for you. So
you guys also take readers, don't you? Like the ones you find in our store.
Yep. People love those, and that's life changing for a lot of people who may not be able to read just because they don't have glasses to help them at near.
Sure. Okay, I guess we're out of here, right, JD? Thank you for our guests, Mathie and Roholt Vision Institute. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, our technical producer, JD DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week. We'll see you right here next Friday on News Talk 1480 WHBC. Gee, I got it in.